This is, an extremely difficult question to answer. In fact, I don't really have an answer. But what I can say is that there are different factors in achieving a pregnancy. One of them is the embryo and the quality, the good quality. And even a good quality or good looking embryo doesn't mean that the embryo is actually competent or able to implant. So we have to think that even if we transfer a perfectly looking blastocyst, spot on, developed perfectly, then we don't really know the actual inside of the embryo, and we know that maybe around 40% it depends on the age of the patient. Obviously, 40% of the embryos are actually not able to implant despite the look fine. So that could be already a reason. Okay. Then other factors affecting implantations are, as we discussed, the importance of the lining of the womb be coordinated or synchronized with the age of the embryo. So that has to be what we call window of implantation. So it's a window of implantation is a time frame where the embryo is most likely to implant. Now, if we get that window of implantation wrong, then the embryo is at a certain stage and the lining is at a stage that could be either a bit behind the embryo or a little bit forward comparing to the embryo. So if that happens, obviously, and there is no perfect synchrony, then the embryo is not going to implant. So that's another important factor. And then obviously that lead to the hormonal environment. Which again has to be perfectly precise, and the thickness that we already discussed, because the thickness is not just what we think, okay, is a measurement. It's not actually, is the whole environment, is the glands, is the substances and the stuff inside the uterus, is the receptors. So there is a micro world or micro environment which is all in that thickness, in that lining, and that is what has to be perfect for the embryo to implant.